Hello everyone. Okay, welcome to today's live stream. Today we are talking about a very common condition that affects probably parents, workers, runners, older adults, and people who stand all day. And that condition is called plantar fasciitis. Plantar fasciitis, many people call it heel pain, foot pain, walking pain in the morning, waking pain in the morning, and some people suffer like for months or even years. And today we'll discuss what plantar fasciitis actually is. Let me look. And why it happens, Western medicine understanding and TCM understanding. Of course, acupuncture treatment, rehabilitation, and also something like footwear, stress and nerve system involvement. And I'll explain the TCM side simply. So people, even some people who are new to the acupuncturists can understand. Let's start. First one, what is plantar fasciitis? Fasciitis is the irritation of the plantar fascia, which is a thick band of connective tissue on the bottom of the foot, as you can see from the picture here. It connects with heel bone, two toes, and what it's doing, its job is to support the arch. We have the arch on the foot and to absorb force and also help to stabilize walking. Okay, every step stresses this tissue, so as long as you are walking. Some common symptoms. Patients may feel heel pain under the foot, first step pain in the morning, and after walking maybe a little bit better, and pain after rest, and pain after standing long periods, and very tight calves as well. Also difficulty walking barefoot. Very classic symptoms include the first few steps are terrible, but then it slowly gets better and it warms up slightly. That's a very typical sign of plantar fasciitis. You may wonder why morning pain happens. This is quite classic. You know that when we are sleeping, the fascia shortens slightly, and then because the first step stretches the irritated tissue suddenly. So morning pain becomes quite sharp. In Western medication understanding, they say plantar fasciitis as overload, tissue irritation, degeneration, tension problem. It's not always pure inflammation. Often it becomes chronic tissue overloaded. We have some common causes, which are standing there too long, especially nurses, teachers, retail workers, and factory workers, like what's shown in the picture as well, overstretching fascia, repetitive walking, and standing for long periods, and also shoes that fit incorrectly or are not adequately supportive. Some poor footwear may include flat shoes or like unsupportive shoes or worn shoes, increase stress. The tight calf muscles, this is quite huge. Tight calves pull continuously on the plantar fascia, which makes overstretching all the time when walking. And of course, weight gain. More body weight equals to more foot loading. We all know that. Another one is sudden exercise increase, especially when you're running, hiking, of course, going to the gym, and some jumping sports like basketball. Then why it becomes chronic? That's because many people, they continue overworking and standing and walking excessively. Before tissue even heals, they didn't give enough time for their tissue to heal. Then the nerve system becomes very sensitized, and pain becomes chronic or persistent. In TCM, Chinese medication, we understand in different way the plantar fasciitis is often Beere syndrome. Or let's make it simple, channel obstruction, especially involving kidney channel, bladder channel, and liver channel, because those three channels pass the area of the plantar fasciitis. You may wonder what is Beere syndrome? Well, for beginners, Beere simply means blockage or obstruction. Pain happens when either qi or blood or circulation, or we can call it energy, do not flow smoothly. Then the pain starts. So that's what we call Beere syndrome. We have different TCM patterns, even different pain, like the different patients, they all have heel pain, but we treat them according to their different pattern in TCM. The first pattern, we call it Callum syndrome. That's very common. Symptoms usually worse in cold weather and quite stiff, aching, feel very heavy, and morning pain. The cold causes a contraction and stagnation of the channel there. That's what causes the pain. The second pattern is called qi and blood stagnation. That's more usual on chronic cases. The symptoms could include fixed pain, sharp pain, probably chronic tenderness, long-term unresolved symptoms. It all happens there. And kidney and liver deficiency. That's the most common cause in older patients because it involves chronic degeneration and long recovery cases. Well, in TCM, the liver, we say nourishes the tendons, and kidney governs the bones. The weak support system lead to chronic tissue strain. Okay, now why calves matter so much? This is extremely important. Many plantar fasciitis patients actually have severe calf tightness. The calf continuous pulls on Achilles tendon and the plantar fascia. If calf tightness is ignored, pain often keeps returning. We should do something to relax our calf as well. We are talking about acupuncture treatment now. We're aiming to improve circulation, reduce pain, relax tension, calm nerve system, and stimulate healing. Again, we have local acupuncture points and distal points. The local one include usher points, where it's where the pain comes, and some heel points, and plantar fascia attachment area. Needling is often a bit tender, but quite effective. The distal points, including, we call it bladder 60, kidney 3, so all those points trying to unblock the channel, like kidney channel, bladder channel, and liver channel. And when you have like calf or heel tension, we use the points, we call it bladder 57, behind the calf muscle to help treat the tension and relax the muscle. Then there will be less loading for the plantar fascia. We also use electroacupuncture. That's very effective for chronic plantar fasciitis, some stubborn heel pain, and degenerative cases. It helps circulation, tissue healing, and nerve system modulation. Another one is moxa and heat. It helps if you have very cold feet. Most patients will have cold feet because of the poor circulation. And stiffness or chronic healing. This is especially helpful for cold and pain patients, but acute swollen hot tissue may not tolerate too much heat, so we may not use these in this pattern. Cupping, I'm sure you've heard of cupping. Sometimes it is helpful around the calf muscles and Achilles region, especially if muscle tightness is severe. We can't do much cupping on the plantar fascia, but we can do the muscles around it to relax it. And of course, rehabilitation is essential because acupuncture alone often is not enough. Patients usually also need calf stretching, foot strengthening, and load management. As I mentioned before, footwear matters a lot, and it's very important. Poor shoes can constantly re-irritate healing tissue. Many patients improve after better arch support, supportive shoes, reducing barefoot walking. I know in New Zealand the barefoot is like a culture, but if you have plantar fascia issue, please stop barefoot walking and buy more supportive shoes. Now, why barefoot walking sometimes hurts, especially on concrete and wooden floors, those hard surfaces? Because the fascia absorbs more force directly. When you wear like supportive shoes, it gives it less pressure. And there are some people only improve temporarily, then the pain come back immediately because they return to overloading. You might make it overloading, standing long time, poor footwear, tight calves again, and the tissue never fully recovers. You didn't allow them to have time to recover. Stress, you may think it's not related because many people don't realize, but actually stress changes posture, muscle tension, nervous system sensitivity. For those people who are constantly under stress, often hold tension through calves, hips, and feet. The body becomes more protective. Do some stress management will help there as well. We know that long-term pain changes the nervous system, then makes pain becomes more reactive more sensitive. That's why some people still hurt, even when scans are not too bad. That's because the chronic pain is connected with the nerve system, make you feel too sensitive. In TCM, pain means something simply is not flowing properly. Treatment aims to restore circulation, reduce obstruction, relax tension, and support healing. There are some home advice. Whenever you can do calf stretching, rolling foot on ball, reduce overloading, always wear supportive shoes, and not complete bed rest. There are some red flags if you have to seek medical assessment, if you have sudden severe swelling and severe trauma, inability to bear any weight, and numbness. Okay, so plantar fasciitis is not simply heel inflammation. It involves tissue overloading, calf tension, biomechanics, circulation, and nerve system sensitivity. The Western medicine focus on tissue stress, degeneration, biomechanics. But in TCM, we focus on qi and blood flow, channel obstruction, cold damp, liver and kidney support. So in TCM, I'd say that we not simply focus on symptoms, we focus on more on the roots, and it helps, the root and the branch. Once the root is treated, and the pain won't come back again. And in the picture here, there's some risk factors. You can read it, and you know that it's one of the most common causes of the pain. So the treatment depends on severity, but you can always do something for yourself, like always wear supportive shoes. Try to avoid standing or walking too long. And try to do some stress management if you do have some stress problem. That will help with the nerve system. Okay, that's for today. Thank you.